Hi, Dr. Adelia Krebs here from Tiger Medical Institute. So today I'm answering the question, how can I improve my cognitive health? Which is a very general question. However, our cognitive health comprises our mental health and our ability to remember and execute on a daily basis, as well as exercise judgment and discernment. So it really affects us in all areas of our life. Our cognitive health also affects the health of our whole body. So our brain's health affects our nervous system, which affects the rest of our body. So it really is all connected. And it basically all starts in the mind. So cognitive health is a big priority, particularly for high achieving professionals and the people that we deal with on a daily basis. I've divided it into optimizing your physiology and optimizing your psychology. So within optimizing your physiology, there's sleep, there's movement, there's our physical environment, and then there's diet and supplements. So generally speaking, an anti-inflammatory diet can be helpful. Diet can look different for different people. So working with a healthcare practitioner can help you discern the optimal diet for you. They can look at food sensitivities and genetics, but generally speaking, an anti-inflammatory diet will be helpful. You can also add in certain basic supplements, but a health coach or a naturopathic doctor or an MD would be the best person to consult with in terms of dose, quality, sourcing, timing. All those details really play into getting the results that you want. And then sleep is a good place to start is often sleep hygiene. So I often recommend the 3-2-1 principle. 3 hours before bed, no food. 2 hours before bed, no work. 1 hour before bed, no screens. And then for our environment, exposures to heavy metals, to molds, and other environmental exposures can have a negative effect on our cognitive health long term. So again, consulting with a trained certified health coach or a medical doctor or a naturopathic doctor is a good idea so that you know what tests to get done and what kinds of exposures to avoid. Also, positive exposures like nature can be really helpful. Fresh air, trees, time in nature, optimizing your space, like avoiding toxic cleaners and just having a lower toxic burden in general can actually positively affect your cognitive health and also reduce certain risks in Alzheimer's. And then in terms of optimizing your psychology, making sure your mental health is intact. If you have any kind of mental health condition, definitely getting that treated, going to see a psychiatrist, or just ensuring that you have basic mental health. Other than that, stress management is key. Our coaches often start with recommending certain breathing exercises, and that can be alternate nostril breathing, it can be EFT tapping, it can be diaphragmatic breathing, or there's also things like meditation. And then social and spiritual health. So spiritual can look totally different for different people. It can be meditation, it can be time in nature or something faith-based. And then social connection. So social connection is actually really important for overall health. Ensuring you're not isolated is important because isolation has been shown to be just as bad as pack-a-day smoking. So we want to ensure just connection to others, connection to purpose as well. So cognitive health, there are a lot of aspects to it. Starting with the basics is great. Movement, our diet, stress management exercises, things like that. But working with a trained functional coach or naturopathic doctor can really be helpful because they can really go over our individual physiology and psychology. And we can really get more specific with our recommendations if we can't figure it out on our own. And as Dr. Amen says, if you change your brain, you change your life. So again, our brain is connected to our nervous system, which is connected to our body. So it ends up having a big effect on our overall health as well as our life outcomes.